So I wanted to make sure she was here in case. Next slide. And these are just the numbers of what she's doing out there to do risk reduction and community engagement. You know, we're in the schools, we're doing so many things. This is her team. So we'll go on to the next slide. So this is kind of the meat and potatoes of, I think, of what you were wanting me to really talk about, was our syringe services program. This year we were kind of hit with an issue. UK used to staff our program, so we didn't have to pay for that salary. They would staff somebody to serve the half day here, which is on Mondays from noon to 4:30, and they would send someone to Harrison County. They no longer do that. Effective July 1st, they termed that program. It was UK Target 4. So we realized that we really needed to continue this, but there was more that we could do. Luckily, there's a lot of grant funding out there for harm reduction, overdose prevention, opioids. So Madison has been very strategic in bringing some of those to me. We're looking at different grants to be able to help. But when I talked with UK Target 4, they wanted me to pay over $80,000 to staff this, continue staffing this model. And I was not willing to do that. That was a hefty salary for what we needed. So now we have hired a new harm reduction specialist, and she's also going to be a community health worker, which means she's going to be out in the community connecting people if they need Medicaid, if they need housing assistance, if they need anything, employment issues. We're trying to do the holistic approach to really get people, into recovery even. The best thing about her is she is a peer support specialist as well, because she has lived experience. She's been down this road, and she knows the beauty of where you can be if you tap into these benefits. We've also, this is going to be expanding our outreach and resource navigation. We are applying for a grant for a community hub for this. So we are really trying to make this program very financially solid for us in the foreseeable future, as well as making sure we're testing more. That's the other caveat. She is currently being trained to do the testing, so we've kind of had to pause on us in-house doing the testing for the past month. But we have the ability to refer that out. When people want that, we do refer that out, and we've got great partnerships with Georgetown Community, Harrison Memorial, different hospitals. So, Judge, I touched on this with you, but one of the things that I'm really excited to do that I would like to find some money for, in case you ever have any extra opioid funding, UK is wanting to partner with us to test the syringes that we are collecting, the 1-for-1. Now, they won't test all of them. They will just test a few that we get in. And it will be, if I'm understanding correctly, throughout the year, not just a one-time thing. So I believe that cost us $5,000, but I think it would benefit this community to know what substances they're finding the most, because we see that there are different times, when there's a spike in something. And so this will allow us, they'll test the residue, and they'll be able to give us real-time data so that we can go out to the police department, do education. So that's something we might talk again about in the future. And then just the next slide are our numbers. This is our 2025 number. Okay, so our 2025 annual report. This is Scott County only, because I felt like that was most relevant to you all. We actually had 303 visits new to the program, or maybe have moved into the area. They might have been on another county's program, or 24 people with a total of 73 participants. Our participants have built relationships with our team. Even though, and our team sometimes does know who they are, even though it is completely anonymous, they get a unique identifier, but these people continue to come back to us. And many times we're able to continue giving them education and helping them. Ultimately, we want to help them into recovery. But what we're really doing is educating, too, on the disease prevention piece. That's why this program was implemented, because Scott County, Indiana, had a terrible problem with the HIV and hepatitis C rates. So we've distributed 10,832 syringes, and about 6,000 of those have been returned. You're not always going to get everybody to come back and bring them back. That's the goal. because it's a one-for-one. We've done 28 outreach events, and we've educated or tested altogether 967 individuals. Or is that individuals or? Okay, I wanted to make sure of that. You see the average age of the attendance to our exchange is 44. So, middle age. And we have seen them from all walks of life. This does not discriminate. We have seen business suits. So I want to make sure of that. Let's go on to the next slide.
Rachel, can I interrupt you real quick?
Sure.
So I'm going over to Narcan on the overdose prevention.
Mm-hmm.
I know you were in syringe area, but
Mm-hmm.
on the Narcan, it looks like there was 1,640 community boxes provided.
No, that's actual bags that are in the boxes.
Okay.
Yes.
So, and then there's the Narcan kits provided. Do you add those together to get the total amount of Narcan?
Oh, okay.
Yeah.
So the Narcan kits provided 139.
Right.
And then the Narcan provided via community boxes, that was 1,640. Okay. So the 139 is only in the exchange program.
Okay, so here's where I'm trying to go with this. I know it's easier to track syringes than it is. Do you know how many participants? I mean, is the same person coming to get Narcan all the time, or you just
So we have a
just do the
QR
boxes and you can't really?
It's a little hard. We have a QR code on the box that we
Yeah.
hope that they're scanning so that we can collect data there. I don't know if we have anything else that really tells us, though, who's coming.
Okay.
Yeah.
All right. That's all I need to know. That's fine. All right, thank you.
On that same topic, that same spot, where'd it go? I was trying to read the fine print, the overdose responses, so you're getting that information from, I guess, EMS, where it says 67 overdose responses.
Right, EMS, and we have the OD map, and then we work very closely with the police department here. We have a great relationship, so all of that data comes in, and that is as of May 31st.
And you said you also have OD maps, is that what you said?
Yes, that's actually a tool that we use to kind of show. Madison, you can speak on that just a little bit because she's more familiar with that. I've seen it.
So it's an online platform. It covers the whole state. It tracks any EMS run or maybe ER encounter that was classified as an overdose on the official documentation, which is why we use the multiple streams of data. I work really closely with the community care medicine team, and they kind of filter through those instances because sometimes though a call is labeled as an overdose, it may not have officially been a call. For example, like occasionally they may be called out to like Walmart or something thinking someone is having an overdose, but they just fallen asleep in their car.
And then along those lines, Coroner Mark Sutton has shared with me recently that last year's data, what you reflected was 5 overdose deaths. And then, can you recall the previous year, Mark? I hate putting you on the spot, but that number's down, I know.
It's been going down each year, I think, which is a good thing.
Yeah. Yeah.
I know the addition of the naloxone boxes here in the community, the data we have is that we've reduced the fatality, the fatal overdoses by 75%. Which is what we want to prevent. We want to try to, the ultimate goal is to, get that person in recovery, but give them another chance, give them hope.
Anything else?
Well, you know where I'm going to go.
I don't have any idea.
I watched that movie.
Yeah, the 67 number is the non-fatal overdoses.
Gotcha. Well, yeah. Before you leave all of this, I don't know if you're familiar with the program that the fiscal court's supporting, the use of the NET device.
Well, I wanted to touch on that because
Good,
we
I'd like to
actually,
hear it.
so I gave you another packet. I don't have a slide for it, but this was our media campaign, and I'm going to go through that really quick right after I'm done with this portion, and then we can talk
That's
about
fine.
that.
That's fine.
Okay.
Yes, ma'am.
So The next slide is our data for 2026, just from January to June. Because with this program, the data comes in usually in a calendar year, which is kind of hard because we report everything fiscal year. So we wanted to put in front of you what has occurred from January to June. With just Scott County alone, we've had 101 visits, new 9, and total participants 36. The testing are listed at the bottom, just 1 HIV and then 2 hepatitis C. And then it gives you the supplies that have been distributed. So testing rates, as we put on here, have decreased due to the Target 4 conclusion. That was when I was telling you all the UK partnership has ended, but we are revamping the program and have just hired a new coordinator. So I really can't wait to come back next year and pray that I have some great numbers for you all to show. Any questions on the syringe services that I can, and again, I brought Madison with me in case you all have something that I can't answer.
I have none. It's good information. I appreciate it.
I feel like we are really collecting a lot more data than when this program started. And I know that Dr. Miller really had to pave the way. We were kind of a trailblazer with getting one of these programs implemented. And I remember her coming in and frustrated, and I can't get, because listen, I get it. It's hard to get behind these things, guys. I was one of them. I worked there, and I was one of them that was questioning, why are we doing this? But once I see the preventative piece, I understand why it's important to our community. The next thing that I want to touch on, because we have changed this program as well, is our Beautiful Minds program. And this is something I'm very excited about. But I'm almost sad that we had to put more money behind this. Scott County, since 2022, has been deemed a hotbed for suicides in our youth. And we work with the coroner's department. We were doing child fatality reviews, but I don't know the exact number since 2022, but when I say child fatality, it would be an unnatural child fatality. And most of them have been suicides, correct? So 10 since 2022 is a high number to me. And that tells us we've got a problem. And what we've identified pretty much with most that we've reviewed with our group is that mental health is at the forefront of that. That's the big reason. And to be honest, most of these are middle-class children. Parents had no idea. Some of them weren't even in this system. But the Beautiful Minds program is a partnership with UK that we are in each of the middle schools here, because the high school has some other areas that they tap into. But we're in the middle schools here, and we're touching the children that are either underinsured or uninsured or just get lost through the cracks. Could be that, their parents don't know that they can get Medicaid or don't have some other payer source. And we've just gone into the SCAP, is it SCAP? The alternative, they've asked us to go there. They've actually called and said, your program is so great, we want to be able to put it in the high school, but that's going to be even more money. Right now, we're about $250,000 that we're putting into this. So that's a big lift for WEDCO. But I'm not saying we can't do that, because to me it is so important that we protect our youth, that we get that mental health counseling to them. But I gave you some information on that, and we're doing screenings. Our Dr. Swigert, who's on our board, she actually is with Georgetown Pediatrics, and she has really helped us push those out. When she sees children coming in the pediatrician's office, we're identifying these children, and we're getting them in, and they become almost family to these counselors that are with them, or the therapist. So I don't believe we've lost a child that has been involved in the Beautiful Minds program. So I know that it's the intention is to not. And to me, one child is worth $250,000. So it's a no-brainer. So I wanted to put some information in there. You all can read that later, but I wanted to make sure you knew that I think it was, 100, maybe close to $150,000 more dollars that WEDCO is putting behind that. Just WEDCO's money alone.
Rick has a question.
So along that line, I know your comments have been focused on I guess, under 18 kids, but I know there's also adults in our community that have committed suicide in the last few years.
Absolutely.
I don't know what that number is, but
I don't have that number either. 9 this year.
9
Oh,
this year.
since January
No,
or fiscal year?
July 1 to,
Okay.
is that right, Mark?
Actually, this year, I think we're at we're at 9.
Since January.
Since January.
Oh, since January.
That's a staggering number.
Well,
that,
and when you mention that it's some kind of mental health issue, I'm sure it's the same for the adults.
we're in a crisis, and
I would agree with
I
that.
kind of wonder, is this what caused, I feel like it's continuing to grow. But right now I don't have a specific pot of funding or something to handle the adult population. But there are some out there. There are some programs. Eastern Kentucky seems to be getting a lot of that. The thing is, access to care is the big thing. And when we did a public health transformation a few years ago, some of our services were taken away because there was access to care that providers could do in the area that were taking Medicaid. We mainly existed to help provide services for many of those when it came to that type of thing, or cancer screenings, that didn't have a payer source. But I can tell we're flipping the script again. A lot of providers are wanting to not take Medicaid now. So we're starting to expand our programs back to try to meet the people where they are, to meet the needs. Because we see that with the Medicaid cuts and different things that have happened, people are wanting to tap back into our services. I like that you asked that, though, Mr. Hostetler, and I will look into, it's just there's a lot of new programs out there now for mental health. I'm not saying they're great, but they're available.
Yep.
So, the next slide talks about our community Narcan boxes, and as we talked about, or maybe it's the next slide, I apologize. One more. Yep, there we go. This is amazing. The Madison has worked so hard with the police department and the recovery specialist. And so when we did this, like I said, it has reduced the fatal overdoses by 75%. That's huge. We just this week modeled this in Harrison County. So Harrison County has just now put them out. There's been a lot of kickback on it, but I need you all, when you're talking with people or if they're coming to you asking why are they doing these things, we need to remember that naloxone and Narcan aren't just for people that have addiction issues. So maybe you have a family member that just came home from the hospital with surgery and they're on pain medication and they forget that they've taken some and take it again. Having this on hand saves that ER visit. It saves precious time. So it's smart for every one of us to have in our home. Or 2-year-old comes into grandma's house and grandma has pain medication and they get a hold of it. So I really try to educate the community because it's not just for, overdose. It's overdose prevention, but it's not just for those who have a substance use disorder. So.
Question about these. What do you do with these? Because I know in the pre-hospital realm, we're always worried about medications in our aircraft and things. So what happens when it gets super hot and or super cold outside? What do you all do?
So the temperature, these are recommended between 40 and 104 degrees. However, they have shown to be sustainable even if they have an excursion below or above that for 28 days. But these boxes are rotated out bi-weekly. All the things are rotated out. They're checked continuously. If we have a very, very high temp day, very low temperature day, we have a team going out to take care of these. So, but we are aware of that. And one good thing is, Madison helped create this, and she's a pharmacy tech too. So we kind of got our bang for our buck with that.
I just figured some of those weeks where we have it super cold, they would just freeze.
Right.
They flipped out.
But studies, they say that for 28 days, they should still be sustainable.
Even if it does freeze and thaw, there's no loss of efficacy as long as you're in that window.
So, which was, obviously we had to look at that because these are resin boxes out in the elements. So, and then just the next slide shows our storage box locations here, just in case you all are curious about that. And then the next slide is our contact information. My cell phone is always on me. Text, call. I'm available for anything you all need. I love being able to connect with everyone. I haven't really gotten to talk with many of you, so it's been great to kind of see you all and interact today. I did give you also the media campaign that you also graciously worked with us on and gave us some funding for.
So let me
And
ask you
this
this. Could I propose this? This is pretty extensive, and it's very impressive. It does mention the net device.
Yes.
Where'd that go?
Would you be available to come back the first Friday in September, and let's go over this document, and then, because the reality is the education piece doesn't ever stop.
Right.
And we should discuss, after you review this, does the court want to consider doing another round of education campaign? So could I propose that route for us?
Right.
Would that work for you?
That's fine. So this media campaign summary of what we've done since you all have graciously given us this money, we can talk about this
The first Friday in September
first Friday in September.
at 9 a.m., and I'll put you on the first.
So I won't
Instead of
freeze.
having to wait- yeah.
So, and here's the other thing, I may bring Madison with me again, because like I said, this entire document, this is Madison. This is her work.
I mean, and like, just, I mean,
So all-
I don't, it's an extensive, it's a lot of information, and the education piece doesn't stop, I don't think, and
She created all of these graphics and had them advertised and worked very hard on this.
No.
Most of it was in the shopper because that's so readily available for people here. But it also
but some of it
talks-
was also social media, and
Mm-hmm.
and
And we branded it, of course, with both logos, and very wonderful. And it did mention in here, which I wasn't familiar with that until you said something, to be honest, because this kind of occurred when Crystal was still here. But it did mention, I think and Madison, you can correct, the net device. And I believe that's actually in our jail.
it is.
So,
We can talk about that, and then just give it the proper amount of
Sure.
time, and then talk about, does the court, because, I periodically get emails it's really on a 6-month basis usually, it seems like, but, we recently received additional opioid settlement funds that are deposited, and I think, we need to consider, do we want to do another round of this? So,
well, this gives you some time for
no,
all
it
of you
gives
to
us time
review
to
that.
chew on it, and, no, and it's a lot of work, and I appreciate that.
Right, and I can't take credit for it because, listen, we have an amazing team. I have them as my experts. I just run the agency and direct them.
And Judge, don't they have to come back and do their tax rate? We could do it all at the same time if you,
I think we just have to acknowledge.
Yeah,
okay,
yeah.
you said-
I don't
we
think I
just
have to
have
be
to
here for
acknowledge.
that.
okay.
Back to the net, you say you're all, I don't see it on there, Judge. Did you?
It's in here.
Yeah, I don't doubt
That's
it.
the other document.
It's in this document, Rick.
This here.
And that's what she's going to come back.
So
and-
this is,
My
yes.
bad. I'm looking at the wrong one.
She's going to come back and talk about that in September.
Well, so on that note, I haven't looked at it, I haven't found it in here. So are y'all able to refer to the net device folks? Are you referring?
So I thought you were, yeah.
So you have you have the
Yeah,
contact
they
info?
directly, they visited the exchange, even met some of our participants. We've got information
Okay.
to hand out to clients and contact information.
With contact info. On that note, I was talking to him a week or so ago. I think we have committed to, at this point, a total of 90 people to treat. I think they're approaching that. I don't know if you've heard from them.
I haven't.
Is that separate from the jail, Rick, or is that?
That's the whole program.
That's total.
That's people that the court's treated outside of jail, just from the community, and people inside the jail.
And I'll be very honest with you, the first I even found out about it was when you mentioned it. Because again, public health is so big, so I've been involved in so many things, and when I started reading it, I was like, this is amazing.
Well,
So it's very,
I'd recommend you have a conversation with our jailer, because they do a lot
Darren.
well, what do you call it? Post-treatment interviews with folks that are still incarcerated, that have been treated.
with this net device.
Yes, they're
And it's-
treated, they probably treated 40 plus, I'm just guessing kind of, but probably 40 of the 90 have been treated there, maybe over that. And some of those folks are serving a sentence. I don't know, but I mean, KET's been down and interviewed inmates a year ago or better. WLEX 18's been down and interviewed the jail staff and inmates that have been treated. It's a big deal going on.
It's exciting
I
to
think
read
it would
about.
be worth your time to
Yes.
sit down with our jailer and/or maybe some of his staff. You'd have to work that out with him. To let you know what that actually looks like, because they're a part, the net device people still administer it from what I understand, but the jail is very involved in
It's a
making that
very
happen.
hopeful,
It's huge.
Yes.
My wife and I are helping folks that come to us that have been treated. We're trying to do a follow-up program because it's radical what it's doing for these people.
I love
In
that.
about
I might
5
talk to you
in
too
about-
about it sometime off,
I'll invite you out. We
Okay.
meet with several women once a week, and sometimes guys show up at Mary Safe Haven. We're still doing that once a week, meeting with them for an hour and a half, and
Let me know.
it's
You've got my
Tuesday night.
Tuesday nights?
Yep.
Okay.
I'll get your information. I'll
Right.
send you.
It's
I'll
on
send you an
I've got it
invitation.
on the back of the
I saw
PowerPoint,
it.
and my cell
I saw
phone's
it.
on there. That's,
Rachel, thank you. This was great information. We'll circle back the first Friday there in September to talk about
Gotcha.
the media campaign.
I'd like to just say, as a board member, Rachel's hit the ground running. It's been a smooth transition from Dr. Miller, and she has new passions, and I think it's given us a new energy too.
Yeah.
And she's just done a great job. Very responsive.
Appreciate
That's been very impressive.
Appreciate that.
yeah, I get to say I'm new for a little while longer, right?
You don't really get to say you're new, Rachel.
Thank you
All right.
for having me.
Absolutely. Mr. Marshall, you requested to address the fiscal court, and I'll give you that opportunity.
Judge, while he's coming to the podium, Mike contacted me probably a month ago. I don't remember now. Maybe many of y'all know Mike Marshall, lives down on Burton, or Biddle end. I guess you're on the Biddle end of Burton. He's been very active volunteer since he's been retired in our community, and which I'm thankful for volunteers. I think we all are. He's been a big force at the museum. Are you still involved with them?
No, I retired from them a couple years ago.
Yeah.
I
So,
was
but
there about 12 years.
yeah, I saw you a lot. So,
A
anyhow,
lot.
appreciate you. Appreciate you.
Yeah. Thank you for that.
Yeah.
And thank you for your time. Mike Marshall, I'm Vice President of the Scott County Historical Society. We have a program that we're trying to get obligors for Governor of the state of Kentucky. The governor was James Robertson, and he was 1862 and 1863. There's 3 governors buried in the Georgetown Cemetery. He's the only one without a monument to him. We are working to get this. You've got a diagram there in front of you. It will be a granite monument. It's going to be 8 foot tall. The cost is $10,500. The society itself has voted to pay $3,500. We're short $7,000, and we're looking for assistance on getting that $7,000, and that's why I'm here. Any questions?
Would we share this with the city? Or are you asking have you all approached the city as well? Or just us? Have you approached the city as well, or just
The
us?
city and tourism. And we're working on a list to continue because we don't know, personally, I would like to see this done this year, but I don't know if that's going to be feasible. But yes, we have, and it's
Mr. Marshall,
funny
is
because city asked me if I'd come to you all.
Yeah, it's the same question. Well, if there's no other questions, then, what we would need is, someone would have to make a motion to make some type of commitment, and you have opportunity next Friday if somebody wants to. If y'all want to email any questions to Mr. Marshall or call Mr. Marshall with any questions, then we can go from there.
What was the governor's name again?
James Robinson. He was Cardone. His house was behind Cardone. When it was a Catholic school out there years ago, the house did burn, and it was in such bad shape they went ahead and tore it down. But that's where he lived. He was Scott County.
Were the other two governors are they from Scott County as well that are
I'm not
buried
sure where
there?
Daisha was from, but Johnson, yes. They were both from, Johnson and Robinson were both from Scott County.
I should ask the history professor.
Yeah, down deep, it's hurt me that we don't have anything for Richard Johnson. He's from the vice president, but he's buried in Franklin County.
Oh, is that right?
Yeah.
They have a big monument like this.
And they never found Elijah Craig.
We haven't found Elijah.
Where's this going to be located?
We're searching for him.
Mr. Marshall, thank you.
Thank y'all for your time.
I have no other information. Anybody in our audience have any information they want to share, or any member?
Can I ask one more question?
Yes, sir.
This
Yes,
is
sir.
off of what the lady was doing, and I think somebody over here knew something about it. You were talking about suicide?
Yes, sir.
Is there a suicide prevention walk in Scott County? I know Fayette County, a few years ago, I attended their first one. They had about 200 people. The next year, it was a little bit more. I had a suicide death in the family in 2016, 2017, and ever since I walked in Louisville. That one down there has around 2,000 participants every year, and it makes a lot of money for suicide prevention. And I was just wondering if they had one here to help. Don't have one. Wonder who you would talk to get one that would help fund something like that. Maybe I should talk to the folks down there in November to see if they can tell me.
There you go.
Okay, good enough. Thank y'all for your
Yes,
time.
sir. Anyone else?
About that topic or other topic?
Mr. Willis, you're welcome to address the court about
Well-
a topic you'd like to.
I sent you all an email, and I had Ms. Hamilton send you the rules and regulations. And I didn't know whether you had any questions for me on what I sent you. And since the sheriff is here, I would ask him, excuse me, to explain his position on why he believes the ordinance should be repealed. Because he and I had a discussion. And unfortunately, I didn't send you my email, but I'm sure somebody from the council did.
I did not receive
I'm sorry?
it. I did not receive it.
Oh, okay.
I think you just sent in a copy of the policies and procedures. Is that what it was? Of the Deputy Sheriff Merit Board
I sent a
in your
copy.
email?
I sent an email
I'm
to
just
everyone
telling, so
on
the sheriff knows
council,
what you're talking about.
but I don't know whether you received it.
So
Okay.
you
But
sent-
he's
so-
reviewed that document.
So
the policies and
Stacy
procedures.
forwarded that document, that's the policies
Yes.
and procedures.
Yes,
But you sent an email last night,
I did.
Oh, I haven't seen
and,
that.
and I have not forwarded that to Sheriff
Okay,
Meadows.
I just assumed someone would forward it to him. But I mean, I have a copy, he's welcome to look at it or have it. I mean, I'm not trying to hide anything.
I think the fair thing, and I don't want to speak for Sheriff Nettles, but the fair thing would be to allow Sheriff Nettles to review your
Yeah.
document, and then if he wants to share his
His thoughts.
with you and the fiscal court, I think that would be the fair thing. And you know, Sheriff Nettles and I have spoken some, and following up your all's meeting, and you know, some of the discussion is, you know, would it be appropriate to maybe have a process that's built in, that's kind of almost tied into our grievance process that already exists, but we haven't fleshed that out very much. You know, in cases where someone files a grievance for termination or suspension, that's kind of the line of the conversation. But I don't want to speak for the sheriff. He's a constitutional officer. I have great faith in his discernment and the way he operates in a professional manner. So I would ask that he review your letter and then respond accordingly, and then we can go from there. And of course, before we do a second reading, there'll be time for comment then as well.
And that's fine. My bad for not sending it to you. I'm not trying to hide anything. I think I've been very, very open in discussions and setting things. But does the court have any questions? And I appreciate you giving me the time, Magistrate and Judge, to even speak about this subject. But I just have I swore an oath to the Constitution twice in my life. And I really have a problem not upholding those times in my entire life. And when I see that you have something that really doesn't happen that often by its own existence, and we have a fundamental problem with the fact we even have it, because we utilized it once. I agree. I'm going to vote for the sheriff in November. I think he's a great man. He's a great leader. I have no problem with him. But in the future, that's my problem. And if we have leaders like him for the sheriff's department in Scott County forever, we won't have to worry about it. But why would you get rid of a process as a fail-safe when that kind of sheriff isn't here? That's my.
I think your request was for him to share, so I think now is to allow him to review your letter and then maybe share his thoughts with you and then share his thoughts with us. And then, I think that would be the appropriate path.
And I agree with you. My only concern is time constraints. And I mean, I've done a lot of research in the last couple of weeks, but the next time we'll meet is when you guys, this
I
court's
believe
gonna
he'll respond.
vote again.
I think he'll respond before to allow for questions in a timely manner, so it's not the night before we do the second reading.
Right.
On Thursday. I guess we meet on Thursday next week. Is that right?
No, Friday.
Friday.
It's Friday. I'm sorry. Brian Pratt.
I have a clarification question. Maybe I misunderstood. So are we looking at disbanding the merit board altogether? So like the process?
We've had a first reading.
Or just getting rid of just disbanding the current board, but leaving the merit board in place, the process.
We've had a first reading on an ordinance to repeal the merit board ordinance. That's what we've had.
That was at the last meeting.
Yeah. Okay.
Anything else?
So the second reading will be next Friday.
Yes. So I'll ask Sheriff Nettles to review that letter. You think you could respond early in the week? Is that fair?
No, I'm game for anything. I just,
Well, I think your concern was that it wouldn't be a response until the night before or such, but he will respond earlier in the week, and that'll allow for questions and comments.
thank you very
And
much.
of course, we will have, if there, always before we'll do a second reading, we'll have time for any public comment again.
I thank you very much.
Yes, sir.
Judge, JR's crew was out at Brookings Park doing demolition and stuff, so that's in process. And
They've made short work of that. I appreciate it.
Yeah.
They were out there late. We had middle school orientation last night, and they were out there at 5, 6 o'clock still working,
Yeah.
almost 7.
Thanks, guys. Appreciate it.
No, thank you. So if nothing else, we will call this meeting adjourned.